I think for a long time, growing up in apartheid South Africa and being sort of part of the marginalized community, with racial segregation. Of course, it's mindset oppression, right? I always felt less than as a child growing up, and even early in my university years, I kind of had the mindset that I wasn't, I wasn't white, and white was privilege, and white was the standard back then. So that inferiority mindset, I think, held me back to a certain extent at the time. But as I grew as a professional, I trained as an optometrist and I went out into practice and I started seeing the impact of apartheid and marginalization, especially when it came to health and health equity in my work. And I realized that nobody was really talking about it. People were just going on, health professionals were just going on with serving individual patients, but yet the system was still oppressed. Um,
Hey friends, welcome to Public Health Careers. I'm Omari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Dr. Diane van Staden. Dr. Diane van Staden is an adjunct professor in the Faculty of Health and Social Development at the University of British Columbia. She's also a primary care network manager at the Shuswap North Okanagan Division of Family Practice. She's a well-rounded healthcare leader with over 15 years of experience in optometry education, program planning, and strategic contributions to sustainably addressing local and global eye health challenges. She conferred a Bachelor's of Optometry from the University of KwaZulu-Natal, South Africa, then a Master of Public Administration from the University of the Free State, South Africa, then a PhD in Optometry from the Technological University of Dublin. In today's episode, you'll hear and learn more about how her background growing up in apartheid South Africa shaped her perspective on health equity, how education served as a tool for empowerment and overcoming marginalization, her process of learning to navigate leadership roles and finding her voice in global health discussions, why it's important for local communities to own their own solutions to their health issues, and why training models must be adapted to local context, and her transformation from clinical optometry to public health to scale her impact, and much, much more. Be sure to hit that subscribe button and enjoy today's episode.
Hey, this is Dr. Diane. I'm a public health advocate and health professions career strategist, and you're listening to Public Health Careers.
Hi, Dr. Diane. I am super excited for you to join me today. So, welcome to the show.
Thank you so much, Omari. It's such a pleasure and an honor to be on your show today.
The pleasure truly is mine. And as I was telling you beforehand, I've been connected with you. I've been seeing some of your work, and I'm happy that I finally got the chance to make this connection and have this conversation.
Awesome. Fantastic.
Yeah.
Thank
So
you.
jumping into things, how do you identify and tell us a little about your personal background?
Sure. I identify as a mixed race woman of African descent. And specifically, I was born and raised in South Africa, spent most of my life there, traveled to different parts of the world, but almost 3 years ago, relocated to Canada. So I would also like to consider myself a citizen of the world. I absolutely I'm fascinated by nature. So I feel so blessed that I'm in British Columbia of Canada because we're surrounded by mountains and lakes and get to see the four seasons. I'm also an ocean girl coming from the coast in South Africa. So I really do miss the sea. I'm grateful I have lakes in BC, but I miss the ocean and the salt water. But yeah, so I think my footprint is more global now, but I'm so proudly African and happy to be taking my influence to the world.
And in that, like being mixed race South African, how does that show up in your work, in your identity, and how you show up in this world?
Oh, totally rooted in that. Thanks. That's such a brilliant question. I think for a long time, growing up in apartheid South Africa and being sort of part of the marginalized community, with racial segregation. Of course, it's mindset oppression, right? I always felt less than as a child growing up, and even early in my university years, I kind of had the mindset that I wasn't I wasn't white, and white was privilege, and white was the standard back then. So that inferiority mindset, I think, held me back to a certain extent at the time. But as I grew as a professional, I trained as an optometrist and I went out into practice, and I started seeing the impact of apartheid and marginalization, especially when it came to health and health equity in my work. And I realized that nobody was really talking about it. People were just going on, health professionals were just going on with serving individual patients, but yet the system was still oppressed. And so I felt a strong, almost, I would say, a calling to be part of the solution, part of highlighting the inequities that existed in eye health, with optometry being my profession. And so after about 4 years, I pivoted out of clinical practice. I'm like, yes, this is good. I'm helping patients to see better, but there's a bigger problem and nobody's really addressing this problem. And I didn't necessarily have the answers, but I knew I wanted to be part of the answer to closing that gap. So I think coming from a background of oppression, recognizing the impact of oppression on healthcare as a trained health professional, I almost took it on myself as a mandate to do something about correcting the inequities. And so that's really influenced the rest of my career trajectory. I think while I initially felt inferior and marginalized, it then became my power that as a person who's lived through these inequities, who's witnessed it, how can I be part of the change I want to see in my world? And so it's totally shaped who I am and what I do, over the past 20 odd years of my career.
I appreciate you sharing that and
Mhm.
opening about that. I think it's important just to just understand that, and the both the systemic oppression that happens globally
Mhm.
and in nations, and then also how we see ourselves in the solutions, or we see that people aren't talking about the issues that are in front of us, and then from that it kind of
Totally.
triggers something to say, how can we do better?
Oh, for sure. Absolutely.
And I just want to dig on one
Mhm.
other question here. So, you're sharing, you're coming from this perspective of the white superiority, and you're feeling inferior and not having access to certain privileges. What in your life journey made you make that switch to say that isn't true, or I've been brainwashed, or whatever the case might be?
I think, having an education, firstly, I saw education as a tool or my ticket out of this marginalization, because very few people of color had the opportunity to get a university education and to become a professional. So from very early on, seeing the poverty and the social ills around me growing up, I'm like, I need better, because I also equated that better to some degree of power. And so having a sort of a health professions qualification, I trained as an optometrist. I had a bachelor's degree at the time. I was a step up. I was now no longer in that cohort of people who are just seen as social outcasts, and the stigmatization that people in my community suffered. So now I was now a professional. I had a qualification equal to people of white race, and I had some sort of respect in society. Um, it didn't immediately change though, but I think over time, as I sat now as a person of color with a white patient in my consulting room in the chair, I am now in the position of power in a sense, if you think of it in that way. I started gradually realizing that, okay, the dynamic has shifted, is shifting for me by virtue of the fact that I'm now a healthcare professional and I am using my expertise to serve people who historically were superior to me. Okay, I now have some agency, right? I'm no longer this sort of marginalized person, outcast person of color who's labeled as A, B, C, or D, alcoholics, whatever, drug addicts. Typically, I come from a community where if I mention the name, that's what people think. And we were called mixed race people in South Africa, or called colored. So the colored communities were typically associated with those kinds of social ills. And I recognized that now I had some degree of respect And not that I was looking for respect from white people, but I think just the fact that I was acknowledged as a professional by the majority. Honestly, I still had some experiences, and I'm talking now about the early 2000s, some experiences where I would take a patient into the consulting room and they would say, like, where's the doctor? And then I'm like, I am the optometrist. So almost had to step into those shoes, earn the respect. And that's when it started shifting in my mind that now I'm not that person. I'm not in that category. Not that I dissociated myself from my people or where I came from, but I saw it as power to change the narrative. And and I think that's what gave me, I think, the confidence to pivot out of clinical practice and say, how can I now step into uncharted territory and become this voice of the marginalized, the voice of health equity, where nobody's talking about the fact that in the early 2000s in South Africa, as much as the country was free and democratic, 20% of people only had access to eye care. 80%, who were predominantly people of color, did not have access to optometry services or primary eye care services. So that really became my driving force and the fuel. I recognized that by virtue of the fact that I had been privileged enough to get an education, I almost was responsible, now that I've seen the problem, to do something about it. I don't know if that answers your question. Quite a long-winded answer, but yeah.
No, I love it. I love it, and I think it definitely does give a good perspective and insight into like the work and how you've gotten there, and maybe help someone else along that journey, as well.
For
And
sure.
to that point, you came into optometry, you saw that there was this disparity. What were some of the strategies that you were using to get to those marginalized populations and better effectively bring eye care?
So honestly, Omari, I had no clue. When I decided I'm leaving clinical practice because I'm seeing privileged people who have money coming to buy spectacles they don't really need. But I know that there's people out there who desperately need them and can't afford them. But I had no idea where to start. So honestly, I took a 3-month sabbatical. My sister lives in North Carolina now. At the time, I think she lived in Washington, D.C. So I thought, let me just go and take time out and research, what is public health? What is public eye health? How can I get into that space? It really didn't exist at the time. So, in reflecting on where I wanted to take my career and how I could break into the public health space, I was, life has a way of connecting you to people that are going to be the stepping stone for the next part of your journey. And I was researching masters in public health. So I thought, okay, maybe having a master's degree in public health is going to be my foot in the door. And so I contacted the university, the Nelson Mandela School of Medicine, which is in KwaZulu-Natal, where I grew up. And I'm like, I'm an optometrist. I'm interested in doing a master's in public health. And they're like, hey, do you know Professor Naidu, who happened to be the head of department when I think I was a final year optometry student? So they reconnected me with him, and he was very excited that I was an optometrist interested in public health, because he'd been an advocate all his life. Initially an anti-apartheid advocate, and as he trained as an optometrist and eye health advocate. And so there were very few optometrists who were seeing this picture at the time. And he's like, oh, I'm so excited. He said, when you get back to Durban, come and see me at the university. And so I did that. I went and I saw him, and I went and I registered for the Masters in Public Health, actually. And then there were early talks at the time about starting a global movement towards creating awareness of the inequities and the disparities in eye care, particularly in low and middle income countries. And he said, look, I can't promise you anything. This is where things are in terms of development stages. But when it happens, you're definitely on board. And so he was on sabbatical at the time. I did a bit of teaching for him, and I took part-time roles at the university. And within about 6 months, what was then the International Center for Eye Care Education was birthed. This was a global advocacy movement for optometry and eye health, and really creating awareness of unmet eye care needs. And so he said, we've got some funding to start piloting optometry services in the public health sector. Would you be interested? The project is in the Eastern Free State, and this is like a central rural province in South Africa. And I'm like, yes, this is kind of what I signed up for. I didn't know the opportunity existed, but yeah, within less than a year of me leaving and having no clue how to get into the space, organically things unfolded because I just knew I needed to be in public health. And so I took on this project. I became the project development officer, had never done any project management courses. I was alone in this rural area. I needed to figure out how do I pilot the implementation of, how do I implement this pilot project? And so that was my first real introduction to creating awareness about the unmet needs for eye care. I had to speak to hospital directors. I had to speak to people in the province. I had to train nurses in little community clinics about what is refractive error, how do we screen patients for visual conditions? What do you do when you find a patient who's got a significant visual problem? Set up referral pathways, develop supply chain systems. And this I learned literally on the go. It wasn't anything I trained for. I'd only done 6 months in a Masters of Public Health. So I was still really wet behind my ears, really green, and I was just learning organically. And so that became my first exposure to being a public eye health advocate. And I loved it. I loved the fact that I could see that as much as the work I was doing was on a small scale, I could see that eventually this is going to grow into something that I foresaw. This is what the kind of movement we need in eye health. So it happened organically. I didn't have a plan, but I knew I wanted to be in public health. And in so doing, I was linked up to these opportunities, and my career kind of just took off from there.
You didn't have a plan, but you definitely had the intent, and you were figuring it
Yes.
out along the way. And I think that's important. Like having that intent gets you in places where you know what you kind of like want, and you can tell people that. And I think that helps you in shaping that future, whatever it might be. But that's awesome. And I'll get back to a couple more questions on that for
Sure.
sure. But as you're saying there, like, what does public health mean to you?
Public health to me means that every person, regardless of where they are, should have access to quality healthcare when and where they need it. And that speaks to my the driving ethos in my career is that every person, not just people in urban areas, not just people of a certain social and economic demographic. Every person, regardless of where they are, needs to have access to quality healthcare when they need it.
Appreciate that.
Mhm.
You recently completed a certificate in health communication from Stanford. How has this training influenced your approach to health systems management and communication?
Thank you for the question. So, I think what I learned in that course is that health messaging is so important and so many aspects about health messaging. And there's a couple of things. It's like, firstly, identifying what do we need people? Who's the target audience? Who's this message for? What is the message? When do we need to deliver the message? Timing is important. Too early, sometimes people don't buy into it. They don't have enough of a frame of reference. Too late, misinformation has already set in. How do we deliver it? What are the correct channels, the correct mechanisms to communicate health messaging? Because how you do it for just the general public is different to how you will do it for health managers or health clinical professionals. And so these are the kinds of strategies I learned in the course, is that it's not just about, we need to create awareness about unmet eye health needs. For who? When? Where? How? Is it going to be understood and received by the people we intended to? So yeah, it was delivered really well, short little videos and some didactic work, that and assignments. But that was my takeaway. It's, yes, we may be passionate about public health and want to educate people, but really thinking about the detail behind the who, what, where, when, and how is really critically important to making sure we hit the target that we intend, or the strategy that we want for that communication piece.
And before you were optometrist, you decided to pursue your bachelor's of optometry from University of KwaZulu-Natal. Tell us about that thought process going into undergrad.
Interesting question, because I always say optometry chose me and I didn't choose optometry. Um, Again, I'm going to go back to just my growing up years. No role models. I was the first person in my family to get a university education. I just knew that I needed to go to university and study something. And coming from, shall I say, disadvantaged school, a school in what we call the townships, it wasn't necessarily well resourced. We had career guidance in our, timetable, but honestly, it was just free sessions. The teacher never pitched up 80% of the time. And so there was nobody really coming and talking to us about, these are your career options. This is how you apply to get into university. All of those things. This is what a bursary or a scholarship is. And so, as much as I was a high achiever in school, by the time I was in my final year of high school, I really didn't know what I wanted to do. I just knew I needed to go to university. I was in a science based stream in high school. So I knew I needed to do something in the sciences. I performed well in the sciences. And so I applied for, at the time, this is 19, late 19, no, mid 1990s. Believe it or not, I didn't even know what email was at the time. It was kind of just coming around. And so I applied just for a bachelor's of computer science, I think, because computers were all the rage, computer science. I had never seen a computer. There was no computers in our school. There was no computers at home, but computer science was the thing, right? This is the way the world was going. So long story short, was the first time in my life I ever failed. Those first 6 months of computer science at university, I bombed out. It was not sitting behind a PC and learning sort of coding language was not for me. And then I had to go back and reflect. What do I do with my life? I need to go back to university. And then I thought, okay, health sciences. I did well in biology. I kind of enjoyed the sciences. I want to have a meaningful profession where I help people. And so I just sort of blanket applied for health sciences. Didn't get in on first application, so did a general BSc. 2 years down the line, realized I'm doing this relatively difficult degree, Bachelor of Science in chemistry and biochemistry. But what am I going to be at the end of this degree? What job will I apply for? Ultimately, that was the goal, right? I had an economic objective as well. I need to get a job so I can build myself up, help my parents, blah, blah, blah. Anyway, applied again to all the health sciences, pharmacy, dentistry, occupational therapy. So I didn't actually have a stream. I knew what I wanted to do. And optometry was the first stream that gave me a placement. And I'm like, yes, I'm going to take it. It was extremely difficult to get in. They took 20 students a year or something. So I just grabbed the first. If pharmacy was, I probably would have been a pharmacist today, but it was meant for me to be an optometrist. And the profession has been phenomenal to me. Honestly, I've been so blessed. It's given me so many rich experiences and opportunities. But because I also took the opportunity, even though it wasn't something I selected, wasn't first choice on my list, it wasn't something I dreamed of being an optometrist, but I knew it gave me the platform to do something more, to make an impact in the world. And I ran with it. And I think because I did, I've also been rewarded in a sense with the kinds of career opportunities that I've enjoyed. And so, yeah, that's inadvertently, I ended up in optometry and I made good on the opportunity that was given to me.
I appreciate you also sharing that and being vulnerable in telling your the facts of your story, because many
Yeah.
people might think that that one failure is the failure, but it might be the thing that leads you to something more beautiful that you never knew existed. And in that, you're able to find yourself kind of how we're going to get into now. So you graduated, you became an optometrist. I think you said you worked clinically for 3 years, and then you switched out. Maybe what were some of those things that you were doing as an optometrist, some high level activities?
In clinical optometry, the work is, I think, fairly clear cut. So you work in a practice, patients book appointments, you do eye exams, and I loved that. Honestly, for the first 3 years, I did enjoy it because I enjoyed working with people, I enjoyed helping people, adding value. And so the reward of, especially I think where I got a little bit more driven towards a public health approach, the reward of people who've not had a pair of eyeglasses ever, and they've got a significant refractive error problem, and they come in and you do an eye exam and they see that you invested, you're doing a quality assessment, and they say, you know what, thank you for spending the time, you've listened to them, and then they walk out with the pair of eyeglasses and they literally see the world differently. It's the quality of life that you've added to them, and then you feel this, it's this feel good sensation that, wow, I've made someone's life better. So that was really a highlight for me, I think, working with individual people and seeing how my work was contributing to them having an improved quality of life. But I soon came to realize that that was just one on one. I was having impact on one person at a time. At most, I could maybe see 20 people in a day on a good day. When was I going to get to the other, so many more people who were not getting an eye exam? And so I started to see the bigger picture that I need to now scale my impact. Yes, I'm adding value in the practice to individuals, but how can I now scale my impact to communities who've never had this? And how can I bring that to those communities? So much as I really enjoyed my time in clinical practice, I knew that that season was over because my impact was limited. And in order to scale my impact, I needed to move to a public health space.
And in doing so,
Mm.
you got your Masters of Public Health from the University of the Free States, and then you're talking a little bit about the conversation and then formation of this global programs officer at the International Center for Eyecare Education. So kind of maybe walk us back through that thought process of going for the degree and then getting into this program, and what some of the, well, you already explained a lot of the key things, maybe just more about the degree and that thought process more so.
Sure, thank you. So I recognized if I wanted to, because this was an emerging space, public health optometry it wasn't a thing, optometry as a profession was kind of sidelined in mainstream healthcare. And I realized that if I wanted to make an impact, and one of the avenues to be able to make an impact on a larger scale was to get a leadership position within government, within non-governmental organizations. But in order to get that, I needed to invest in myself and equip myself with the master's, which was respected. If I wanted to apply for any management position within the Department of Health, that would stand me in good stead. So that was my thinking. Let me equip myself for a management or leadership role in healthcare within the country so that at that level I would be able to influence policy and systems change. And so I'd mentioned registering for Masters in Public Health at the Nelson Mandela School, but because I took on the role of the Project Development Officer, I moved provinces and I had to leave the Masters in Public Health because that was a contact program. Every Saturday we would have lectures and group sessions, and so I couldn't physically be present. And so when I was in the Free States, I then transitioned to a Masters in Public Administration and Management. And to a certain extent, I did that because they didn't have a master's in public health there. But also, I thought that if I don't restrict myself just to public health or optometry, I could have done a master's in optometry, but I felt it would have sort of closed me off in the discipline. And I could have a much broader reach if I just did a general master's in public management. And so, yeah, a little bit, I guess a little bit of strategy. It was just what I needed to do because they didn't have the MPH and I couldn't transfer my credits. But it equipped me with insights into, at that level, what are the things I need to know and do if I'm going to step into a leadership position. And so it was the next step up the ladder. Honestly, when I did my bachelor's, I had no intention of doing a master's. I was done. I wanted to burn my books. I didn't burn them, but I think I gave them away. But and then I realized, out of necessity, invest in myself. It would give me an advantage if I wanted to get into leadership role and really influence at the level I thought was necessary. So that was the thinking behind that. And once again, even though I didn't know where it would, I kind of had an idea as to where I wanted to take my career. I didn't know if it would pay off, exactly what role it would lead me to, but it was another rung in the ladder of my career that had I not done that, of course, I would not have gotten the PhD scholarship and would not have had other opportunities. So sometimes my advice to the listeners is also sometimes you need to evaluate where you're at, what you want to do, and then seek out those opportunities, even if it's learning opportunities that you think are going to prepare you for the next stage. It may not benefit you immediately, but it's another piece in the puzzle of your career. And then when opportunity does present itself, you're already ready. You've equipped yourself. You're ready to step into those roles. And I'm not by any means saying that postgraduate degrees are necessary to have leadership or management roles in public health. But for me, certainly, it just opened the next door, which when I moved to being a global programs officer, and I was working in international development at the time, specifically in global eye health, I was then afforded the opportunity of this PhD scholarship, which again, I never thought I'd ever do a PhD. But the funds were there. The funder said, we want to invest in 5 PhDs that can help inform eye health on the African continent and specifically Portuguese speaking Africa. And they couldn't find any in Portuguese speaking Africa. There were no optometrists at the time. So the money was there. It needed to be utilized. I was offered an opportunity for one of those 5 scholarships. If I didn't have a master's, I probably wouldn't have been able to do the PhD. So yeah, sometimes just taking those opportunities, no matter where you are in life, sets you up for the next thing, even if you don't see and know what that next thing is.
Absolutely agree with that.
Mm-hmm.
And to your point earlier, so you came into this global programs officer role. You were doing a lot of different work, I would imagine, and you
Mm-hmm.
said you learned how to do a lot of that on the job. Maybe what were some things that you developed in yourself to learn those new skills and tools and implement them, or like what advice would you give to someone that is coming into a role that has a lot of different new skills or responsibilities and are learning on the job? How would you advise them going into that type of role?
Firstly, I would say believe in yourself and your mission. And I'm not saying I didn't necessarily believe in myself, but for me, that stepping into that role was a big leap because now I was on a platform where I was engaging with global leaders, like presidents of the World Council of Optometry, chairs of boards of the International Council of Ophthalmology. And I would go to these big meetings, and in my mind, I'm still the small mixed race girl from this, marginalized community in South Africa. So I'm like, who am I? I think I think I might have just been finishing my master's at the time when I started that role. So I just have a bachelor's degree. There's all these important people and all of these educated people. And as much as I'd done lots up to that point, I was a little bit intimidated when I got into those spaces. And it took me a while to find my voice. So my advice to others stepping into bigger platforms, but platforms you're meant to be in and impact, is believe in your mission and believe in the power of your voice and find your voice. I remember the first 1 or 2 years, I had an excellent mentor. I referenced him earlier in the show, Professor Kovanaidu. Actually, he headhunted me for that position. And he would take me to these big international meetings, and you're sitting with mostly males, mostly white. And he would say something. He would nudge me, and I was too scared to do that. And after a couple of those meetings, I had to have a chat with myself. And I'm like, why am I afraid to speak up? Because they would be having conversations and obviously deliberating on some of the solutions and strategies to address this unmet eye health needs globally. And while the conversation is ensuing, ideas are in my head, but I'm too afraid to open my mouth and share them. And 5 minutes later, one of these very important people says the exact same thing that went through my mind 5 minutes ago. So I realized then that my thoughts have value, my opinions matter. And slowly I started finding my voice in these spaces. So I think, especially as, a person, of my demographic, a person of color coming into spaces that were previously dominated by people who had some power or status or recognized as such, just be bold enough to step into your shoes. Own your space, speak your truth, contribute to the conversation. Don't feel like you the newbie, you're the outsider coming in, and so you need to kind of earn your stripes first. I think if I found my voice earlier, perhaps my trajectory could have been escalated a little bit, but I'm grateful for where I've learned, I grew, and I think when I found my voice, it's just like the wheels started turning so much quicker for me. So that would be my advice to anyone wanting to come into bigger spaces.
I appreciate that, and I definitely think everyone should continue to use their voice, especially if you're in the room. You're in the room for a reason, and using your voice
Yeah,
is important. And I think even to add to what you were saying, even though he thought of what you were saying 5 minutes ago, you have a different lived experience that I think,
that's
and many of us
right.
come into rooms with this lived experience, which is so important, and that perspective
For
and
sure.
insight is important. And to consider that we haven't been given the opportunity to be in those rooms and have those conversations, I think it's just really, really important that we do use our voices. So I appreciate you sharing that.
Absolutely. You're welcome.
And you said within this, you're able to get that PhD in optometry from the Technological University of Dublin. Maybe what were some takeaways, or how did this help? Because you said they were doing this for the African continent. So how did this help shape you as a leader in that work?
Yeah, that was a phenomenal opportunity. So initially, I was involved in what was then the Mozambique Eyecare project, which was establishing the School of Optometry for Mozambique and to serve the rest of Portuguese speaking Africa. And through the funding for that project, which was funded by Irish Aid, I was then granted the opportunity to do the PhD. I think I already had uh, agency, if I can call it that, in the Mozambique Eyecare project with people I was working with on the ground, other international partners, other donors. And so the PhD was really just almost the cherry on the cake. I got to own not just my role of implementing this project or supporting the implementation of this project, but in terms of defining how similar projects implemented in low and middle income countries, not just in Africa, but other parts of the world, can adopt more equity centered practices. So, historically, globally funded partnerships in Africa have really had a top down approach. The money's all in the north. The money comes from these Western countries who are the powers, and they have dictated how projects get implemented on the ground. So, my PhD was really how do we um, how do we define equitable partnerships in globally funded projects for eye health? And it's really about that, in a sense, transfer of the balance of power to the local communities and local partners so they own the solution, because evidence is that that's when it will be sustainable. When we come with top down solutions, oftentimes 5 years later those projects fizzle out. So yeah, that's what I learned, and that's how it helped me continue with my work about coming into development work with respect and humility, appreciating that context is important, and we often, as the outsider, may not understand the context. So giving voice to local partners to shape the solution, own the solution, and you come with your expertise to add value to that. So that's really my rich takeaway from my PhD and working with the Mozambique Eye project.
That's really phenomenal work, and I think that's what we need more of just everywhere. Is how do we come in and give that power to community to create the solutions that
Mhm.
they see they need, because they're the people that are most
Right.
impacted and know how we should be dealing with these issues. So that
Absolutely.
that's really awesome that you're doing, and I hope continuing to do a lot of that work across the continent and the
Yes,
world.
for sure.
And then
Yeah, absolutely.
after that, you shifted into a role as an associate professor of optometry at the
Hmm.
University of KwaZulu-Natal. Am I saying that correctly, by the way?
KwaZulu-Natal, yeah.
KwaZulu-Natal. Okay.
That's good. That's good.
So tell
Yes,
me
so
about that shift into academia. Yeah.
yeah, so I see I guess, pivot in my career was the next step in incrementally influencing how eye health is shaped, the development of eye health services to marginalized communities. So I was a global programs officer for much of my time in international development. And then for, I think, the 6 months prior to joining the university, I went into managing one of the subregions in Africa because I really felt I would have more influence in shaping the implementation of projects. But soon I started seeing the picture. We were implementing these schools of optometry, largely adopting models of training, some curricula and content from elsewhere in the world, and recognizing that this is not suited to the African continent, and how we're training healthcare professionals or eye health professionals is not really going to meet these unmet needs. So we were still adopting a very Eurocentric model of training where it's patients in private practices and not really community oriented, public health focused. And so I thought, well, the next level is if I want to influence how students are trained, change the mindset and the ethos within training programs, I need to be in a university. So I joined as a lecturer in 2011 and was then really teaching for the first couple of years while I was completing my PhD. Didn't really, I think I felt I did, as just being a lecturer, I didn't have the power to change what was happening in the undergrad program. I mean, I could influence certain aspects of it, but very soon again realized I needed to be in a leadership position if I wanted to influence significantly. So became the academic leader of optometry, and during that time became an associate professor, which was a natural progression of just promotion within the university system. And so as part of that, then influencing transformation in the curriculum. How can we look at more community-based training models so that students are exposed to public health, systems, public health approaches to eye care. And so, yeah, that's how I progressed. I recognized, again, being in a leadership position will help me to influence transformation and innovation in optometric education. And then, yeah, so it was promoted to associate professor and but on the basis of my research in the same areas, public eye health and health professions education.
I appreciate you highlighting that,
Mm.
and it kind of like highlights the importance of, because many times you think, okay, let's just implement this program or let's build this school to get these professionals here, but then not considering what is the curriculum and how are we training these
Oh, yeah.
professionals, and does that make sense for our context? And to your point, does that actually
Mm-hmm.
fill the need gap that's there? And many times we mightn't be doing that. So I think it's really important how we are implementing and really being culturally sensitive to how
Oh,
things are
sure.
going to show up in the work.
Most definitely. Yeah, so that's my passion. Yeah, I guess in this phase of my career, I'm still in that phase of how can we influence how health professionals are trained so that they come out having a mindset of impact on a much bigger scale than just individual patient care. And it doesn't mean that you have to move out of your role as a clinician, serving individual patients, but how can you be more community minded in your approach? How can you be more, as you say, culturally sensitive, understand people's lived experiences in the context of their health needs, and help to influence change in some of those areas?
Yeah, we need that in all I feel like clinical professionals to kind of have that type of mindset, because that has not been the case. But um that's a broader conversation, not for today.
Yeah.
So you shifted into a role as a primary care network manager at the Shuswap North Okanagan Division of Family Practice. If I'm not wrong, that is in Canada. Am I
That's
correct or
correct.
wrong?
Yep.
So tell us about that shift, South Africa to Canada. That's a big change. How did all of that come about?
Yeah, sunny South Africa to the frozen north, as people would say. um, yeah, I guess on different levels. So my sister's lived in Canada for 20 years now, and my second sister has lived in the States for about 25 years. So it's always kind of been at the back of my mind that I need to be on the same continent as my sisters. They were not, as much as their hearts were still in Africa, I recognized that lots of time had gone by. So it was something I had briefly contemplated every now and then, and took a sabbatical in 2022, was it? I was due. I had been 5 years in leadership at the university. I needed a break. I wanted to refocus on my research career. And then, was associated with University of British Columbia, came to do some research with them in the health equity division within the School of Nursing at the Faculty of Health and Social Development. And so that was really my break. And I think also reflection, is this really what I want? My parents had decided to relocate to Canada. So that was part of my motivation to try and be closer to the rest of my family. But also, again, as I said, being globally minded, how can I take this message? How can I take the work that I've done? And I was quite curious to see, is it different in the first world? Is what I'm experiencing in Africa, are they the same? Are the challenges the same? Are they different? And I was very surprised to see very much the same health systems, public health type challenges, health professions, education challenges here in Canada. And having recently come back from the American Academy of Optometry meeting, very similar challenges in optometry education in the States when it comes to just, understanding context and more public health approaches to eye health. So, yeah, so it doesn't matter where we are, we all kind of on the same journey of trying to build more equitable, culturally safe health systems, train health professionals appropriately. So within that sabbatical year, eventually things worked out. My husband had found work in Canada that allowed us to stay permanently, and we liked the slower pace of life here, and of course being closer to the rest of my family. And it became a decision in that year to sort of make it a permanent move. I was still attached to the University of KwaZulu-Natal for another year. And then after that, started reaching out I thought either I can go into academia in Canada, which opportunities are limited, or I can go into the health system where there's lots of need for people with management and leadership experiences. So started applying for work. And then, got the opportunity to work with the local health division, implementing a primary care network strategy. And that's really to strengthen access to primary care. It's a huge problem in Canada. How can we make sure that people have timely access to family physicians, to allied health services? And that's really what my role is now. So it's just healthcare more broadly, not eye care, but similar principles of how can we ensure that people everywhere have access to the healthcare they need when they need it.
Was there any difficulty in that transition for you, whether professionally or life-wise, that you're willing to share, of
So
course?
yeah, absolutely. So the difficulty was more professionally. I think it took a mind shift. So leaving academia was, I felt I lost my pride. And leaving, I'll say that loosely because I'm still an adjunct professor with the University of British Columbia. I'm still an honorary associate professor with the University of KwaZulu-Natal. But not being full-time in an academic environment, I felt a bit of loss of professional identity because I'd spent so much time in an academic world. And now it was just almost a small part of my life, and I was focused on something else. So it took a big mindset adjustment. And the other practical adjustment was just understanding how the health system functions in Canada. Really took me a long time. I personally feel it's quite complex, unnecessarily so. And so there's so much opportunity to streamline and simplify and, improve efficiency within the health system. And I hope to some extent that I can add value and contribute to that. So those were my big adjustment. Life-wise, I think, we were coming from a very rushed life, and, life was busy. Life used to very security conscious lifestyle. And then we came to the interior of British Columbia, which is laid back, and it feels like you're kind of on holiday the whole year round. And, you don't have high walls and security fences. And so we enjoyed that change. And so in terms of my personal life, it's been a welcome adjustment. Professionally, it was a bit of a challenge just adjusting to my new role. But I'm grateful that I still have attachments to academia. I still supervise graduate students, so it keeps that part of my life and my identity alive.
That's real. I feel like the transitioning of identities and like how that makes us feel. That's something I feel like we don't talk about a lot.
Oh, totally, totally. I've got so many
Yeah.
friends who can attest to the same thing. So, yeah, another conversation that we can park for another day.
Absolutely, absolutely. And so you are a visiting, you were or are a visiting assistant professor, health and social development, and I think you got promoted into an adjunct professor role at the
Mhm.
Faculty of Health and Social Development. Can you tell us more about those roles?
Sure. So the visiting assistant professor was when I was on sabbatical. So
Mm.
that's the designation given to people who are coming just in a visiting capacity to do research with local academics. And then last year in the fall, I was invited to be a sessional lecturer for one of the actually social determinants of health, which you'll know from public health. Being a public health person, I'm quite passionate about that. But I couldn't do it under that designation, and I still wanted an affiliate. So they needed to sort of cancel my visiting assistant appointment to be able to appoint me as a sessional lecturer. So in that transition, I was then offered an adjunct position, which is for 5 years. I still maintain my affiliation with the institution. And as and when opportunities come up, whether that be teaching or research, I'm still considered sort of on staff at the university. So that's how that happened. I taught for the fall semester. It was nice to have the experience of teaching in Canada, which wasn't all too different from South Africa. I think the student mindset and culture is just slightly different, but it was nice having that experience. So now I just collaborate as and when needed with academics in the school.
And in these roles that you currently have, what are things that you enjoy most about it?
I'm a creative person. So I love, especially, and that's what I love about academia, is that problems create opportunities, and opportunities generate ideas, when you're a creative person. So I love the fact that we can look at something and this is an issue, and then I can strategize around these are the ideas from the problem. So that's really what energizes me. We have an issue in society. We need to come up with some strategies or solutions to address it. And just the creative process of fleshing that out, testing it, through research, tweaking it. And yeah, that's what I love doing. And I guess it's the same with my graduate students who embark on a research project. It may be, longer term, 3 years, 5 years or more sometimes, but then they have an idea. They want to solve a problem. You do the research, you see what the results are, and you learn from that. So that's what I love about it.
And before I move you on to the Furious Five part of the conversation, I would like to ask, where can people connect with you and where would you like to see yourself in the future?
Sure. So people can connect with me. You can find me on LinkedIn as Diane van Staden or Van Staden, however you want to pronounce it. On Instagram at Life Beyond Clinical Practice, or the website is Life Beyond Clinical Practice. That's a podcast I host, which is really helping health professionals build purpose-centered careers so they can find greater professional fulfillment and make a greater impact in the world. Exactly what I've done in my career trajectory. So that's how people can find me. If they want to email me, they can email me at info@lifebeyondclinicalpractice.com. And where do I see myself in 5 years in the future? I would really love to continue my work in shaping how health professionals are trained and helping health professionals align their careers with their gifts, talents, passions, and interests. Because I've come across in my journey too many health professionals who are disillusioned, discouraged, apathetic, and yet there are so many things that they could put their hearts and their minds to doing that align with their passions, but the system has suffocated them. So how can I help them to see that opportunity, step into that opportunity so that they can find their joy again? So yeah, this year I kind of outlined a book. I'm hoping to write a book about the same, along the same lines, and just really, speak at health professions conferences, speak at professional conferences, the same message. So it's bringing the public health ethos and message of how can we have a greater impact as health professionals beyond individual patient care. Health systems all over the world are struggling. And so I think there's work for everyone to do, and you just got to find that thing that lights you up.
Absolutely, and I'll be sure to link the podcast below. Is anyone well? How did you get interested in like starting up the podcast and sharing more about conversations around life beyond clinical practice?
Mari, it's organically. If I can just take 2 minutes to explain. So, when I was academic leader of teaching and learning at the University of KwaZulu-Natal, that's when I was really, how do we drive transformation and innovation in health professions education? And so I started what was initially a video series. So I would get academics in a studio. The university had its own television studios, and we would have conversations about what is curriculum transformation or what are the needs. And I realized, okay, this is wonderful. But if I'm going to have this sort of bringing just local academics into a studio, it confines me to just people within my university or my province. How can I reach a broader audience? And that's when the idea of podcasting came about. And so I converted that to podcast conversations in health sciences, which I say now was a hobby because I kind of just did it whenever I found someone interesting to interview. But when I transitioned to Canada, with our immigration, and I started to see the challenges health professionals were facing, like myself, with professional identity. How do you transition into different roles when your context changes or whatever? I started seeing the need for a more focused podcast around careers. And so that's how Life Beyond, it evolved from conversations in health sciences where I would talk to a broad range of health professionals just about what kind of work they are doing, some interesting things that they discovered in their career. And then this became more of a careers focused podcast. So it's still fairly young, just 1 year old. And I've gotten good feedback like, we need more conversations like this. Nobody's really talking about these things. And so it's really just to say that, hey, this is a safe space. It's not all perfect. I haven't had a perfect career journey. I've made some mistakes. I've learned some lessons, but these are the things I think can help you if you're feeling you're at a place where I once was. This is what worked for me. So that's how it was birthed. And I'm hoping just to scale the impact of that to more people in the coming year.
Love that. And I wish you great success in those endeavors.
Thank you so much, Omari. I appreciate it.
You're welcome. So moving on to Furious 5, the 5 questions that I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Number 1, I would say, or let me keep it to 1, is find your niche. Identify your niche. Identify the area you feel you want and need to make an impact in, because you have to be passionate about that thing. Public health is very broad, and you can really niche down to a very small area, small demographic. You want to help women in their 50s, get better access to cancer screening services. Whatever your niche is, find your niche, step into that. Own it, find spaces to expand your influence in that area. Because when you're clear about the impact you want to make, opportunities will then be easier to come by and identify. So, find your niche, step into it, own it, focus on that. Carve out your
Number
lane.
two.
And yeah.
Love it.
Number
Love it.
two. Yeah.
Number number two. If
Yes.
you're talking to someone wanting to get into your position, what advice would you give them?
I would say, I think it links to number one. If you know your niche, you're able to then identify strategic opportunities that will be next steps to grow your career and grow your impact in the spaces you want to work. So I've worked and seen lots of health professionals who, yes, they want to grow, they want to do different things, but they're not very clear on what those things are. And so they start latching on lots of unrelated activities and opportunities that really don't get them far. So once you know what you want to do, then identify strategic opportunities that can help you to grow in those spaces.
Number three. What's something you're working on improving in your life right now?
Focus. The discipline of focus. I think being a creative person, working in the space you see so many needs and opportunities, and it's easy to get distracted and want to sort of solve all the problems and, do a little bit here and do a little bit there. And so just being able to focus on one area or one project at a time or one activity at a time is a discipline I'm constantly working on and have gotten a whole lot better at. But yeah, it's still something I consciously have to do on any given day, and to help with my own productivity and output. Otherwise, I find I'm dabbling in so many things, and I want to keep all of these balls in the air. And I think just being able to focus is what I'm really worked on for 2024 at least.
Number four.
Mhm.
Professionally, do you recommend anything?
I would say the book, The 7 Habits of Highly Effective People. I think such simple principles. If you want to be a leader in public health or a leader in general, I think just invest in yourself, invest in reading. As a young professional, I love reading personal development books. I don't have as much time for reading now, even though I've got a whole library of books. I had to get rid of all of them when I left South Africa, and I've accumulated the same number in the space of 2 years. But yeah, reading, I think, and investing in your personal development. But 7 Habits, I think, is a gem for me.
And last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
Your story is your power. I think owning who you are and using your frame of reference as your power to make a difference in the world, not seeing that as a tarnish or seeing that as a disadvantage, but rather how can you use your story, your lived experience to make a difference in the world. So own who you are, own your voice, own your message, step into your power.
Thank you, Dr. Diane, so much for this conversation. I thoroughly enjoyed learning more about your journey and the work that you do and continue to do.
Wonderful, Amari. It's been an absolute delight chatting with you. And thanks once again for hosting me on Public Health Careers. And I hope the audience also enjoys some of the insights I've shared today.
They absolutely will. Thank you so much. And everyone, thank you all so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a like, a review, and share it with a friend who gets some value from it. And I will see you all next week. Peace out, everyone.